and in terms of the immunology, do you think that we're going to be needing booster shots down the road, and where do you see that kind of evolving down in the future?
Another good question. So we don't know yet. What I suspect is that depending on what types of variants of concern will be emerging and circulating, it might actually be more of a fine-tuning the vaccine to address the circulating environments as opposed to a true booster. And again, it also will depend on what situation we're at, right? Like if we're still in God, I don't want to even say wave 5 or 6 and in a year, then the stakes are high. You're going to want to have those high neutralizing antibodies circulating in people's blood so that you prevent as much transmission as possible. But if the rates are extremely low, you may not need such high level. So it's a very good question, and it'll depend on the situation we're at next year. But my thought it would be like more if there are a lot of variants that actually show that they don't that the vaccines are not able to protect or prevent against, then that might be more of an adjustment of the vaccine, which they're already in the works right now.
So if you think about the Clarity patients, and particularly those on infliximab, where you see this attenuated response to natural infection and to one dose of vaccine, one might hypothesize that the immunity will wane rather quicker than those people who are not on those medicines. So we will find that out through Clarity, because these patients are still going follow-up. They still get a blood sample every time they come for their infusions. So we should, within the next 6 months, when it's really relevant, have a good understanding of whether or not there's anything particular for our patients that merits a booster dose.
That's a good point, because again, not all patients are equal and will have the same. It's very heterogeneous, right? And so for the immunocompromised or patients exactly like that, they may actually require boosters.